Hi class, my name is Deja Bowen and I did my social problem paper on HIV and AIDS prevention in the bisexual African American male community. So the reason why I chose this topic was because in the African American community, being bisexual, especially for a male, is very looked down upon in the African American culture. It's not very talked about bisexual African American men and HIV, and it's really kept in the closet just because as African Americans we're very religious based, and we just try to hide that side of a black male or just in the African American community. But I found that the African American males have the highest percentage of HIV and AIDS in every category and in the African American culture. Among African American gay and bisexual men who have HIV have a lower percentage of wanting to know their status compared to HIV positive gay and bisexual men of some other races or ethnicities. So this is very common. Bisexual African American men do not want to know their status because of their background, because of where they come from. So they just choose to keep it quiet, and that's how the disease spreads so much in this population and why it's growing. And that is why African American bisexual men are the highest in prevention. And I was surprised to figure that out because I thought it was still women, but it's not. It's bisexual men, particularly African American men. And some of the factors and stuff that play into that is limited access to quality healthcare, lower income, education levels, higher rates of unemployment, and incarceration may place some gay and bisexual men at higher rates of contracting HIV or AIDS. Also, young black African American men ranging from 18 to 25 are more likely to have sex partners that are older than them. Therefore, they are likely to encounter HIV positive partners. Having sexual relationships with older men may increase risk of exposure to HIV. Unfortunately, we have not achieved similar success in reducing HIV diagnosis among black African American gay and bisexual men who represent the new diagnosis among African Americans. So this is new and it's growing. When we look at HIV prevention, there has not been a lot of research for this population. They are trying to come up with effective strategies and interventions that could help this population, but I've come across community level risk reduction interventions. They have been effective with black bisexual men, and basically community level interventions have a stronger effect and normative and structural influence on HIV risk behavior than individual interventions. So just like community level would say, like having programs or communities coming together to talk about HIV and preventions, having take-home tests so they can test themselves. Also having groups and other black African American males come together is definitely a work in progress, but it's being beneficial. Just seeing off of social media and reality shows more African American males that are bisexual are coming out on TV, and it's making other men feel more comfortable, African American men comfortable, to go get tested, to talk about it, to spread the information, you know. And it's positive. It's slowly coming around, but it's gonna eventually get there. And also, we need to educate our social workers, our therapists, and when we do these interventions on the African American Black culture, so they can understand where these men are coming from and all the stereotypes and all the backlash they get from being bisexual and being a Black man. So definitely having these interventions can be effective. So I wanted to talk about some advocacy groups. And with the advocacy groups, most of the organizations that I found offer free testing, in-home testing, and community-based outreaches to talk to bisexual African American males about prevention and healthy living. So I'm glad these organizations are doing community-based level interventions, because that's where it's gonna bring awareness to. So the first organization that I looked up and researched was the Brothers United Incorporated, which is a nationally recognized community-based organization which provides HIV, STD awareness, education, and prevention services to community members. With the assistance of Brothers United, it continues to develop and deliver supportive, preventive, and mental health services, which helps with the stigma, discrimination, and oppression among those who are affected by and living with HIV. They are a nonprofit, and they rely on public and private support with individuals, corporations, foundations, and government agencies to continue the need to meet the needs of their community. Brothers United is the largest African American AIDS service organization in the state of Indiana. They also strive to educate and uplift their community in effort to reduce HIV and other sexual transmitted diseases and increase the number of healthy clients living with HIV. They have been around for about 15 years and have been servicing the city of Indianapolis and the state of Indiana. They also do advocating and community service. They also do workshops for young adults, and they do transgender services for African American males, which I thought was fantastic. Getting that young crowd in and getting them involved, getting them to be with other peers that are going through the same thing as they are, and making sure that they know it's okay, that, you know, protecting yourself, getting tested, that is okay. I also found another organization which is called Black Men's Exchange National. It is one of the oldest and largest community-based movement to promote healthy self-concept and behavior, cultural information, and cultural consciousness among gender-loving, gay-identifying, and bisexual men of African descent and allies. BMX provides prevention counseling, conferences, and trainings for young African American men. The men we serve are diverse in class, age, philosophy, and sexuality. BMX also is a very good organization because they're not only in one state, but they're international. But in the States, they have multiple chapters in California, Atlanta, Florida, Texas, New York, Washington, D.C., and they do have some that are internationally. So they're reaching out just not only in the United States, but in Africa or in other places that our Black men are at, to help this awareness be brought to our community. We also have the National Black HIV Awareness Day, and it's annually an annual opportunity to promote HIV education, testing, community involvement, and treatment in Black communities. National Black HIV/AIDS Awareness Day is a day to increase awareness about HIV among the African Americans and encourage people to get involved in prevention efforts, getting tested, getting treated if they have HIV. Ending HIV is a stigma that needs to end. People being judged because they have HIV, or people being judged because they are bisexual. It's just one of the things that National Black HIV and AIDS Awareness Day is trying to stop, so that this population can be more comfortable and reach out more for help. So the National Awareness Campaign applies to social work by servicing a time to help a population needing resources and information on prevention. As social workers, we are supposed to know resources to help bisexual African American men be more aware of these opportunities. Even if we don't agree with them being bisexual or religious reasons, we still need to help them, because this HIV and AIDS is growing in this population, and something needs to be done. Lastly, I wanted to talk about the Centers of Disease and Control and Prevention. They also did a campaign under Act Against AIDS and Start Talking and Stop HIV. This national HIV prevention campaign is the result of input from more than 500 gay and bisexual men from various racial groups, ages, and areas across the United States. The campaign was created by and for gay bisexual men to promote open communication about a range of HIV prevention strategies for sexual partners. CDC also invites others to share on social media, talk to others in their community about prevention, and incorporating educational presentations in the community events to address prevention issues. As social workers, we must uphold our ethics and advocate for everyone, to service the underserved, and promote the importance and centrality of human relationships. So with that all being said, I hope you guys do look into more about this topic, because it has a lot of information and it's not something that I hear a lot, and it just really caught my attention, and it needs to have more awareness brought to it. As an African American female, I always want the best for our community, especially our males, because they go through so much, and as an African American community, we all need to stick together and help each other rise above and succeed. So that is my presentation. Thank you all for listening. I would love to hear your guys' comments and replies on this presentation. Thank you.